governor's executive order allowing virtual participation and conduct of meetings due to the COVID pandemic. The conduct of the meeting does allow public participation or public access via both Zoom and telephone. I do intend to allow opportunities for the public to participate during the meeting. Those times will be announced when it's appropriate. In general, that's usually following board discussion of a particular topic. And other than that, the meeting is being recorded. We will be hearing from a variety of people who will be introduced prior to their speaking. So with that introduction, I'd just like to offer a few comments. We have a pretty, I'll say, impactful agenda for tonight because there's been lots of new events that have occurred that we need to try to account for, some of which were from the governor's guidance, which was issued today. And I'll just offer, we're still in the process of trying to digest the governor's guidance. It's quite full, and in some cases it appears that things are, the same thing is stated differently at different parts in the presentation, so we're trying to make sure we fully understand it. Part of our task for tonight will be to make sure that we are aligned with the governor's guidance and the state's guidance, which we will certainly attempt to do. But I just ask for your forbearance because from both the members of the board and the members of the public, you know, we don't have full encyclopedic knowledge of the state's requirements, and you know, it's going to take us a little while to adjust. So with that, the first item on the agenda is an update from Cheryl, our health director. And Cheryl, I imagine you have a lot to brief us on.
I do. Good evening, everybody. So as you know, the governor announced the 4 phases today, and he expects each phase to last about 3 weeks. He still is asking that we have gatherings of 10 people or less. He's changed the stay-at-home order, and it's now called Safer at Home Advisory. And that, you know, basically the changes were that you can leave your home for healthcare, worship, permitted work, shopping, and outdoor activities. So he's changed it from pharmacy and groceries to all those that I just mentioned. In addition, effective today, he's allowing worship, construction, manufacturing, and essential businesses that are already in operation. They're still allowed to be open, but they need to comply with the applicable standards that he's outlined. And then on May 25th, we'll have hair salons, barbershops, office spaces can have a 25% capacity, labs, car washes for exterior and self-serve only, pet grooming, and retail curbside pickup. And again, all of these are going to be sector specific with workplace safety standards. And I should mention the worship is allowed to have 40% occupancy. We also have seen some, as Bill mentioned, we've seen some conflicted information. So there is, I've seen information on the state website regarding outdoor activity advisory. And this is for phase 1, limited contact sports allowed. And it speaks to what we're going to talk about later tonight with limited contact athletic fields and courts open for non-contact sports, tennis, catch, etc. But it specifically talks about players being from the same family only. In addition to that, I've seen on the website phase 1, which is effective on May 25th, that some athletic fields can be open with guidelines. So, you know, we'll talk about that later, but I just wanted to mention that before we get into it. And then 2 meetings ago, I think the board did a face covering order. And I just wanted to confirm with you all that what the expectation is that everybody wear a mask, except those unable to wear a mask due to medical conditions or minors under 5. So I just wanted a little bit of confirmation from you. And then today in your packet, I included an updated testing guidance for suspect COVID-19 cases. And this is a bit long, but all symptomatic shall be tested. Includes, and the symptoms include fever, chills, shaking, cough, shortness of breath, O2 saturation, fatigue, sore throat, body aches, loss of taste and smell. And then there's other less common symptoms, the inflammatory conditions that you're seeing on the news. And then in the elderly and chronically ill, they're seeing some blood glucose loss of control and alterations of mental status. So then the testing's also been updated for required for close contact. So being coughed on without a proper PPE and timing of tests. So close contact with any COVID symptoms should be tested promptly and anytime during the contact's 14-day quarantine period, even if they have a previous negative test. And then close contact, a person without symptoms, they want them to be tested ASAP. Contact must quarantine for 14 days, even following a negative result. And then the reason I'm bringing this all up is there was some other documentation about antibody testing. So the majority of tests currently available have not received FDA emergency use authorizations. They should not be used for diagnostic purposes. More data is needed on the characteristics of tests, the immune response to COVID-19, the timing and duration of antibody response, and how antibody correlation to protect immunity. If healthcare provider orders antibody tests, it is also recommended that a molecular diagnostic test be done. And Heather may speak to that as well, but I just wanted to point out that that was in your packet. I think that's it, Bill.
All right. Well, thank you, Cheryl. That's quite a bit. You did ask for one thing, which was a confirmation on the mask policy.
Yes.
So just curious, I mean, is there any different guidance from the state than we'd received previously?
No, so it was just the way it was worded in the order, and I read it. We've gone back and forth about reading it. If you can't social distance, you have to wear a mask. But if you can social distance, you shouldn't wear a mask, which is what the governor's order said. So I was just looking for confirmation for that.
Okay, I think I see Mark is unmuted, but just 1 second. I think our intention was that, it's not that you can't wear a mask if you social distance, it's just perhaps not required. Mark, do you have a comment?
Yeah, when the thing was drafted, we talked about it. Instead of going through all the language, I think we were trying to say, looking at it, was accepted by the governor's order, which was really unable to wear a mask or face covering due to a medical condition or otherwise exempted by DPH guidelines. So, I mean, the intent writing it that emergency night was to track the governor's language, which was, and I thought that was pretty clear in the discussions before, it was the medical, except for a medical condition or DPH guidelines under 2, less than 5. So the point being is, I think there was a question of what was the exemption, people trying to read it broadly, narrowly, or how. And I think at least my understanding and my intention was that it was tracking the governor's order that if you're unable to wear a mask due to medical conditions, that was the exception.
Okay, so Cheryl, to be responsive to your request, I mean, I think as Mark said, our intent was to track the governor's order, that exceptions were limited to those specified by DPH, and it was just to provide, since there was a local enforcement option of the mask requirement, we wanted to make sure that the local authorities had Board of Health authorization to enforce it. So I just ask by poll of the members, does anyone have a different understanding of what we voted that night? Let's start at.
Yes, I thought the governor recommended before that if there was social distancing, that there was no need to wear a mask. Like if you're outside or if you're walking down the street for exercise. So is he being more restrictive now?
Well, like I said, Dr. Bill, I believe the intent is to mirror the governor's order. So I didn't hear Mark say that we were going to be more restrictive than the governor's order, just that we were going to mirror it and the exceptions would be read narrowly, meaning that, limited to people with a medical condition, children under the age of 2, whatever else was the DPH explicit guidance.
I mean, that still doesn't answer the question about if you're in public, social distancing, whether you need to wear a mask or not. Or if you're sitting out front in your lawn, do you need to wear a mask?
Well, I believe the governor's order actually says, where you can't social distance, you must wear a mask.
Correct.
So presumably that would mean if you can social distance reliably, then you wouldn't have to. At least that's how I understand it. Mark, did you have a different opinion?
The order was written, there's certain spots where if you're inside a municipal building, and the idea was that if you can't wear a mask, then you're not going to enforce the order. That's the same thing the governor said. So we're not talking about when and where to use a mask. We're talking about being specific, saying the exception is for medical reasons or exempted by DPH guidance. So I think we should track the same language and do the same issue and requirements and just be consistent, because this was to provide local enforcement and delegation authority and to cover municipal properties for these orders.
So I think what I heard you say, Mark, is whatever the governor said, that's what we're saying.
We're saying that our order would incorporate the same thing. So you would not be required to wear a mask if you're unable to do so for medical reasons. I don't think we're suggesting, as some other communities have, that you need to wear a mask even if you can't medically wear one. And I don't think that would be inappropriate. I don't think that was what was voted or intended.
Well, and Mark, let me ask you with Dr. Bill's question specifically. If you're sitting out in a chair on your front lawn and it's 20 feet to the border of your property in any direction, then are you required to wear a mask?
Governor's order doesn't appear to, because your social distancing, it only applies to certain public places and other enumerated areas. So on your own premises, social distancing from others, exempting your family, other members in that household, then that would not be a requirement.
Great, that's the way I read it as well. Dr. Bill, does that answer your question?
Yes, that's fine. Thank you.
Ms. Becerra, are you in agreement that that's what our intention was?
Yeah, my understanding was we were having a parallel order, to mirror what the governor's recommendations were. So, yes, that's my understanding.
Thank you. Mr. Cruz?
I have no comment. Thanks, Bill.
Okay. Cheryl, does that help you with your question?
It does, thank you.
Okay, very good. Thank you. Did I miss anything? By the way, can anyone see me? My camera shows that it's on, but my preview is blank. No? Okay.
Nope.
And here I'm all expecting to be ready to get a haircut, and you can't even see my my golden locks that I wish I had. Okay, just checking. Sometimes you have that where the camera's on, you think it's not, and you're surprised later that it was in fact on. Moving to the next agenda item, which is an update from the Acton Nursing Service. I see we have Heather on the line. Heather, You had a pretty eventful week, it looks like. Can you fill us in?
Hi, Bill. Yeah, we had a pretty eventful week. So the new updated numbers will be out later tonight after the meeting, but we did change the way that we were reporting this week based on a lot of questions by residents asking how many people are still in isolation, how many recovered, and how many fatalities they are. So we did change that as of last week. And, you know, of course, once we do change, people then don't want us to change the reporting. So, you know, it's a little challenging. We're trying to be transparent with everyone and do the best that we can to get information out. You know, so we're going forward with this new reporting system, and hopefully, you know, everybody gets some benefit from how we're doing it now. The cumulative cases in Acton tonight are 151. 68 of those are in isolation. So I did get an update from Benchmark at the Inn at Robbinsbrook. They continue with 5 residents that had tested positive and 4 staff. And the new updated numbers from Life Care Center of Acton are 63 residents and 21 staff who have tested positive. Back to what Cheryl, and before I forget, Christopher Foy, who is the Executive Director of Life Care of Acton, I believe is on the line. So he was happy to be on the meeting tonight. If anyone had, you know, additional questions, he's more than happy to make some comments. But before we do that, just on what Cheryl talked about, a couple of the new changes, a couple of the new guidance out by the Mass Department of Public Health, as she mentioned, most especially for surveillance and contact tracing and testing. Close contacts of positive cases are now, the recommendation now is to get tested as soon as possible, regardless of if you are having symptoms or not. As she said, if you obviously test positive without being symptomatic, you're put on isolation. If you test negative with from the test, you still have to finish that 14 days of quarantine on the off chance that at the time of testing you were infectious in that 48 hours or so before most people are starting to show symptoms. So you will be still required to be on quarantine. The other big change is we received a lot of antibody testing results over the last 4 to 5 days, maybe. Most especially Friday and Saturday, Sunday, were the highest amounts. So the Department of Public Health had put out guidance, and I believe I talked about this last week. The guidance, and they're still obviously going to be updating as things change. The Department of Public Health is not recommending, as Cheryl said, antibody testing for the fact of none of the tests that are being done right now within our state are FDA emergency authorizations. They're not under that guideline. And the tests are so different and the results come back so differently that there's different interpretation for all of those results. But the other piece of that is, for us as a public health department, if somebody has antibody testing done and it comes back positive, we are to take that positive result as a positive COVID-19 test, regardless of if they've had a previous test come back negative in the past, or positive, actually both. So as an example, I had someone last Friday, I had a couple of people last Friday. One person had an antibody testing done and had not had a test, a nasopharyngeal test done in 2 weeks from the time they had the first test that was negative, and then they had an antibody testing done. So based on that fact, the recommendation from the state was that this person should get another nasal pharyngeal swab as soon as possible. They will be on isolation until that test comes back. The only exception that the state is really looking at, and it's still a case-by-case basis, but typically, if you have a nasopharyngeal test on the same day that you have an antibody test, and you test negative on the nasopharyngeal swab, but positive on the antibodies, you don't have to be on isolation. Otherwise, everyone has to be on isolation. So what they're doing is that's just coming back as another positive for us as a department of a local board of health to put folks on isolation for 14 days from that test. So again, the recommendation is not to do that yet, but if you are doing it, you should request that your physician is doing the nasopharyngeal swab at the same time. So we've been calling some folks that are confused as to why we're calling them to put them on isolation, because most of the testing companies and the labs that are doing this are not telling people that if it comes back with positive antibodies that they'll be on isolation. So it's been a little bit confusing for residents, not knowing why we're calling, because they didn't think that the antibody testing would get reported to the state, but based on their guidance and what they're following right now, that is the guideline. And then my only other comment was your conversation about the masks. I think what Mike was saying is exactly what the governor stated. The only exception of wearing a mask is for anyone who has an underlying medical condition who cannot tolerate having a mask over their face, and anyone under two or under. So otherwise you socially distance. If you cannot socially distance, then you have to wear the mask in that situation. And Cheryl did mention one other thing that I just wanted to reiterate, the groups of less than 10, that we talked about this at one of our meetings this morning, and that does still entail inside and outside for any group gathering. So I know there was a question about it at one of our meetings about, it being the holiday weekend next weekend, but the guidance does say still less than 10 is my understanding. So we go on from there. I think that is all that I had.
Well, thank you, Heather. Probably, I understand that the situation in the life care facility has deteriorated somewhat, and so, it's Christopher, it's a gentleman, is that correct?
Correct.
Christopher.
Boy.
Yeah,
Yep.
okay. I have a daughter, Christine, but she also goes by Chris, so just wanted to make sure. I would be interested in just asking if, but in just a second, Heather, I very much appreciate everything you're doing. The guidance as you just described it, you lost me about halfway through, so I'm very impressed that you can keep this straight, particularly since it seems to be changing on a fairly frequent basis. So thank you for updating it. Thank you for making sure that we are following the most appropriate and recent guidance, because it is a bit of a moving target, it seems. But hopefully that will start to stabilize, and particularly as we see people returning to work, I suspect we're going to see, and it's actually more of a question. I suspect we're going to see more cases, because I assume employers are going to start requiring testing more, which might result in more positive cases. Was that what you would expect, or not really?
I mean, potentially, Bill, I would expect that we will have more positive cases, especially with the guidance of direct contacts, with the recommendation to be tested as soon as you realize that you're a direct contact. Dependent on the timing of that, you know, a lot of those folks could come back positive as they are being tested.
Okay, well,
And
thank
then,
you.
you know, obviously, like you said, businesses, that could be another piece, especially once the medical offices start open. I don't know if there, you know, there will be, companies or locations of hospitals or doctors' offices that are expanding, you know, other healthcare, chiropractors, acupuncture, you know, those will all be opening soon. And I don't know if they'll have their own guidance for their own employees, but, you know, it could happen, definitely.
Okay, thank you, Heather. I'd ask at this time if members of the board have questions for Heather, and I'd like to just, if it's acceptable to the board, segregate it between questions for Heather about the town's response to COVID, and then the situation at Life Care, which I imagine members of the board may have other questions. But we have the director of that facility on the line, so I'd ask if we just first talk about town-specific issues, and then we can talk about the Life Care situation. So, Dr. Taylor, I see you've unmuted. Do you have questions or comments for Heather?
I did want to comment on the testing. Cheryl had sent me an earlier testing form by the state, and it was so chaotic, it was really hard to follow the directions. Now, the one that's come out now is pretty clear cut. The antibody test is not meant for diagnosis. So that if someone has a positive antibody test, the recommendation is they get the other test for the virus. And if they're positive, they're a case. And if they're negative, they're not a case. I mean, it's pretty clear cut. Because
That's correct. That's correct. But people have been refusing to get their second test done because they believe that they're not positive. So I'm just throwing that out there. That's the guidance we received.
Yeah, but this should solve the problem you were having, I think, of the state wanting you, you know, to follow up in isolation anyone who has a positive antibody test.
Not necessarily, because they have to be on isolation until they get the other test done for diagnostic.
Right, that's fair.
Yep.
But the whole discussion we had last week was, you know, they were telling you to isolate someone with an antibody positive test. So now they're not saying that.
No, they still are saying that. They're saying to do the isolation, and once they have a negative nasopharyngeal as a follow-up, then they don't have to be on isolation. That's the only thing that would get them off of isolation.
Okay. So they're splitting the infinitive.
Very good. Thank you, Dr. Bell. Other questions or comments from members of the board? Okay, seeing no one virtually raise their hand. Oh, Mr. Conaby.
Yes, hi Heather, thanks for the update. I guess my questions to you are you seeing any other trends or other issues in the community besides the congregate care settings right now which have changed?
No, still haven't seen any trends. That there's a multitude of situations.
Okay, and I guess you obviously had a change in the reporting that was requested for the number of fatalities. Are you going to update that every day or every week considering the small number? What's the plan going forward on that?
I believe we will be updating it daily like we have been on the website.
Okay. Good. Is there any other action needed on that matter?
I don't believe so.
Okay. Have you had any self-reporting of cases, or most of them come through Maven at this point?
We still do have some people that will self-report once their testing has come back. Depending on the lab, the turnaround time can be anywhere from 24 to 72 hours. It's usually the folks that are getting their immediate response within 24 hours that will end up calling us just to say, they've gotten that and they've started to isolate. So there are people that are definitely reaching out, but the majority comes through the Maven system.
Okay, other comments or questions from members of the board? In that
Hey,
case,
Bill, sorry,
Mike?
it's Mike. How are you doing?
I'm well. Mike, how are you?
Oh, good. Heather, thank you very much for the update. I had a question about municipal employees. Have any been presumed or confirmed cases within the town?
Not that I know of, no.
Okay, thanks.
All right, thank you. Cheryl, do we have any members of the public wishing to ask either you or Heather questions?
I don't have any hand raised, so no.
Very good. Mr. Martin, you have anything you wish to add or question?
Nope, nothing. Thank you, Bill.
No worries.
Bill, one quick thing.
Yes, Mark.
Heading back with the changes that just happened today about reopening of offices and public buildings, and there are certain requirements for the employers. So I guess a plan for hygiene and reopening and testing and logs. Is that going to be something which the nursing service and health department are working with staff to implement? And it's going to be a big task.
I think you're addressing that to Cheryl for
Well,
town hall
also-
in particular.
Well, because you have to do a health and safety plan, I didn't know if the health department was doing that or whether the nursing service, where demarcation is on some of these tasks that have to be completed for reopening.
Mark, staff has been working on developing, we just received new guidance today, so we'll probably have to adjust it a bit, but we have been actively working on that.
Yeah, it only came out today, so it's
Exactly.
obviously not effective till next week, but it's just on the to-do list before the next meeting, unfortunately for everyone.
Along those lines, actually, maybe this might be a bit of a segue, but what's the consensus opinion of when, I saw some things about like gardens, zoos, parks could open on May 25th. Would that, Cheryl, in your opinion, would that apply to the parks in Acton? I'm thinking of one park specifically in North Acton. It goes by the name of Nara.
I put that in my document for discussion later, but yeah, I think it does mean that.
Okay, that's fine. I'm sorry, I didn't see that. That would be, we'll discuss it later then. Okay, in that case, I'd appreciate if we could move on to the situation at the life care facility. Would you mind if you could give us a brief update? My particular concern, as I sort of expressed last week, is it seems that people that were in the, I'll call it clean area have, become ill and become infected. And, it seems that there's some, I'll call it leakage for lack of a better word. And how might that be addressed so that we can stop any further people from getting infected?
Yeah. Well, thank you for inviting me. I appreciate it.
Thank you for coming.
Thank you. So part of the thing with the virus, and even as I could hear the panel, discussing here, is it was for us. We actually did the whole facility on April 27th and 28th. We made the decision to test all the entire facility for it, and with that first round of testing, we had 22 residents that tested positive, and we were able to immediately isolate those residents on one unit with one certain staff to get them off the unit. The downside to that was there was a majority of the residents that tested positive had a resident that tested negative. So at that time, they did have a negative test, but we did have to put them into like another separate area of the facility, kind of under suspicion, which we had to kind of watch. And then as the time went on, because unfortunately the test is kind of a shot in time of when it's, about, how much of the virus is present in the person as a viral shedding occurs. So we did get more positives after that quarantining period of the 14 days. And then the other piece for us is the way that our nursing home is set up is that we have, the way our rooms are set up is they share bathrooms. So we have 2 residents, and then there's a bathroom in the middle, and then 2 residents on the other side. So as we were still quarantining people and moving people, if one person used the bathroom, if they didn't know they had it, if somebody was asymptomatic, so it kind of, it did spread, and it did kind of, we did have more residents that ended up being positive. We had to create a little more areas. But once we got through that first phase of testing everybody, and then we followed the quarantining thing and people that were in observation, then we did second rounds of testing for people that were symptomatic. And the nice part is we're able to test in-house. We're able to get the kits from Emerson Hospital so we could react to it pretty quickly. We had about a 24-hour turnaround on the testing side. So right now we feel comfortable that we do have it on a sense where we have everybody separated in the right areas. It's been 4 days since we had to test anybody, any of the residents. And we've actually kind of moved forward a little bit where we had 5 residents that we were able to move off the they were in observation to move them to a clean area. And then we have 10 residents now this week that we're moving to our COVID recovery unit. So it took us, I think, a little while just to identify everybody, again, with a lot of people in a small area, a lot of common spaces that were shared. At first, it was a little challenging, but we were able to, again, the more testing we did, it really helped identify it, and then we got the people to the right places.
Okay. Well, thank you. Do you continue to test on a periodic basis? And I guess my concern last week was that it seemed that people that were in maybe they were in the suspect area or maybe they were in the confirmed clean area, but it seemed they were becoming infected. And so my concern was that there was someone who was asymptomatic and actually was testing as negative, but in fact they were infected, and then they were spreading that to other people in the clean areas. Have you do you do like testing every 3 days or something similar to that? Any kind of cadence?
As of right now, the biggest piece, and to follow the Governor Baker's thought process, is he wanted all nursing facilities in the state of Massachusetts to be at a minimum to test 90% of their residents. And we tested 100%. We got everybody tested. So just by doing that first round of testing was nice because we were able to identify people, and for the most part, they were asymptomatic at first. I have residents right now in their 80s and 90s that have been asymptomatic for 17, 18 days that we're still following. We've tested the second round of people for the ones that showed the symptoms. So we do a big thing, testing the vital signs each shift, several times a shift, depending on the resident and their needs. And if there's any suspicion of a respiratory infection, we can immediately quarantine somebody. We can contact the physician, get an order for a test, and we can test them. And then we've been using Emerson Courier, the Emerson Hospital Courier services have been bringing our samples to a lab in Cambridge. And then we've been able to get them back in 24 hours. So so right now we're only using tests for anybody that has anything new. And then as far as returning the people, from the COVID recovery unit, we're using everything time and symptom based as we kind of move them forward in the facility.
Okay. Well, thank you. This may be a time to ask, do members of the board have questions for Mr. Foy or comments? Dr. Bill.
Yes, I'm grateful that you decided to test everyone. I sent you those two articles that talked about a nursing home in Washington State where there was a lot of pre-symptomatic spread. And I also congratulate you on then waiting for people who were asymptomatic to become symptomatic and then testing them. Because the incubation period from exposure to when you get ill is anywhere from 2 to 14 days on average. 5 is the most common. So what happened, a lot of the negative people, when they tested, were actually asymptomatic, but and then later you identified them when they were ill and tested them and separated them. So I think you've done a very good job, as you probably know. And the number of deaths in Massachusetts, half of them are from nursing home residents because they have a lot of underlying medical conditions and they're more vulnerable as patients. So it's a challenge for any nursing home.
Thank you, Dr. Bill. Other comments or questions from members of the board?
Hey, Bill.
Mr. Cruz. Hello, Mike.
Thank you. So one thing I learned recently from the last couple meetings is that staff members are shared between facilities. Is that still going on?
As of right now, no. That is that's a big issue that is is more of an industry kind of related issue that we're looking at. People working at hospitals, part-time at nursing facilities, people working home care full-time, part-time at hospitals. There is a lot of sharing, but we've been able to, in our area here, we have a good relationship with our other SNF partners, as I would call them, in the Concord area and the Acton area, and communicating with them of getting them to kind of stay at one place, especially during this time. And we've done a good job of that. We've worked with like Rivercrest in the area, Care One. Some staff has stayed over there. Our staff has stayed here, and it's been much better for us to kind of manage that piece with it. But as of right now, pretty much everybody that we have works for us. I do share a few with the VA hospital, but that's kind of few and far between. It's more on the per diem staff.
Okay, so that's good news. Is that a policy at this point to not share, or is it just where we are right now with the pandemic?
It's not a policy. I think that there's going to be excuse me. I think there's going to be a lot of stuff as the federal, well, for us, the federal government, the state government, and local governments. I think there's going to be a lot of Monday morning quarterbacking, kind of figuring out, what we can do in the future, to prevent things like this. It's not a policy that we have, but I think it's something. It's kind of like we don't have a policy for it, but it's kind of, everybody feels more comfortable. And even the staff members here have kind of talked to their fellow staff members is like, just stay at one place, because, the whole point of this is creating less exposure. So if you work at one place, then you're only, you see, say 110 residents. If you work at 2 places, then that's 240 residents. You work at 3 places, and then that exposure grows. So even a lot of our staff members have worked with each other as colleagues to kind of just, hey, you know what, why don't you just work extra here? We are allowing them to pick up extra shifts. We do have some overtime. We do have some different shifts for them to make up for some of that lost revenue. So that's been good for them, or lost wages. Because if they're working full-time for us and they picked up, let's say, 2 or 3 shifts a week at another place, we've been offsetting them by letting them work overtime shifts for us. And then by letting them do that, that means that I have less people coming in contact with my residents. So it's been working out.
Okay, thank you. Just last question from me is, do you think there, in retrospect, that Life Care of Acton could have done things better from an administrative standpoint? And second part of that would be, do you see anything the Board of Health could have done differently?
I think that one of the things that I'm very happy with is working with the local community. I will say Heather has been absolutely fantastic, very open, but very knowledgeable and a great resource. But right before we had our outbreak of that, I have reached out to Heather. Well, Heather reached out to us, and then we created a rapport. We talked. I worked with Acton Fire, Wade Messamore. Had a pre-talk with him, kind of how we do things and how we can work together. I reached out to Acton Police, Jim Cogan, to speak with him about, this is where, this is our plan, or this is what we're doing. This is how we're working during this COVID outbreak before we had it. Emerson Hospital, we have a wonderful relationship with one of the ER physicians. We do weekly conference calls with the hospital to kind of focus on what we're doing and how we're working together with them. Even the Acton Funeral Home, Kathy, she reached out to me. So we kind of had discussions before we had our outbreak, and I think that in itself really made a huge difference on keeping everybody informed, being above boards, and then just truly, as things were happening, how can we help? What is the best thing to do? And what's going on? And I think that, in retrospect, I'm very happy that the town and the community was able to work with myself in our facility and with everybody together, I think, to help us out. That was great.
Okay, well, thank you very much. Any other questions or comments from members of the board?
Yes, I have a question, Chris. This is Tom Jacoby. Is Life Care still accepting new patients? And if not, do you suppose that once all the people there that are in isolation go through it successfully, that your situation will not be a crisis anymore?
As of right now, we're not taking new admissions. We're taking, the only people we're taking back are our residents that are on a bed hold. So if we have a long-term care resident and they needed to be transferred to the hospital for whatever reason, and they're admitted, when they're ready to come back, we're fully accepting them right now. As far as taking COVID negative residents, kind of like people for short-term rehab, kind of back the way we were, that's going to take us a little while. I think my biggest thing right now is focusing on the recovery plan, is to get the people that are doing well, that are asymptomatic, get them back to the COVID recovery. And then once we get there, I think we'll get back to it. I know we're working very closely with the hospital. We have our weekly conference calls, and they're talking to us and the other SNFs in the area about what's our recovery plans. When do we think we can take admissions? How many do you think you can take? We're kind of at the beginning of that. The other SNFs in our area, there's like 6 or 8 of us in this area, had cases before us. So they're well into their recovery and kind of probably about 4 weeks, 3 to 4 weeks ahead of us. So we're still right now focusing on just managing our cases, minimizing, exposure with what we can, and taking care of what we have. And then once we can stabilize that, get more recovery, then we'll talk about with the hospitals about bringing in a new admission.
Thank you.
All right, thank you. Anyone else from the board? All right, Mr. Martin, any questions from the selectmen?
No, thank you, Bill.
No problem. Cheryl, any questions from members of the public?
I do not see any, Bill.
Very good. Well, and thank you very much for the update, Mr. Foy. I do appreciate taking the time. I wish you obviously very great success in combating the infection in the outbreak in your facility, and I hope it continues to get better and improve till it's gone. So thank you again for attending our meeting.
Thank you very much.
Thank you. Next on the agenda is Mr. Mangiarotti. Did I say that right, John?
Yes, good enough.
Close enough, yes. Well, I apologize. I also have a name that nobody can spell right when I say it, but usually they can they can pronounce it when they see it. Anyway, I believe you wanted to talk to us about the plans for town meeting. We'd be very interested to hear about that.
Yes, thank you, and thanks to the Board of Health for everything that you've been doing and meeting multiple times a week and really stepping up as volunteers. We really appreciate all of your support and guidance over the last few months, and continue to look forward to continue working with you. Along those lines, the Board of Selectmen last week asked me to come up with a plan to hold a town meeting that is short and safe. So I've been working with the moderator, who I believe is available if we have any questions for her. I've been working with Mark Hald and with Cheryl, and Eva, the town clerk, just to try to figure out a way that we could do this. And I wanted to make sure that we came to you for any input or guidance that you have as a board as we undertake this planning effort. I am presenting tomorrow night to the Board of Selectmen a tentative recommendation for how to hold a town meeting at the end of June. And basically the way that we would do it is to try to reduce the warrant articles that are going to be discussed. And I have some recommendations that we're working on the boards to consider tomorrow night on articles to remove from the warrant. Some different articles to add to the consent agenda if there's a willingness to do so. And then working with the moderator on presentations to try to limit the length of those, but more along the lines of public health. It's clear that having 600 people in the auditorium like we have sometimes is not going to work. The average attendance for an annual town meeting is between 300 to 400, I believe, based on the recent work of the Town Meeting Improvement Committee. So I think we can expect a turnout in that range or likely lower. And we think that the best place to do that indoors would be the gymnasium, because the seating capacity is near 1,000, and we're not restricted with fixed seating, so we can really spread people out. There's also the opportunity to get fresh air into the room because we can open some doors. The auditorium does not have that capability. And so we would get rid of the clickers. We would not have any clickers because it would be very difficult to try to keep those sanitized. And the moderator is comfortable using alternative ways to count votes in the event that it's needed. And we would make the check-in would be contactless. It would be the same as any other queue that you've been in during this pandemic. We would set it up so you have to be 6 feet away from the person in front of you with tape on the floor or some other way to do that. And inside the gymnasium, we would keep people more than 6 feet apart throughout the entire way. We would provide hand sanitizing opportunities and masks if people lose theirs or break theirs while they're in there. We would not allow tabling, which is a common thing at town meeting, where people sit there and hand out flyers about interesting things that they're working on. That's not something that we're going to be able to allow, given what we're dealing with. Other things that we're looking to change are, the microphones. Normally, if you go to town meeting, you have to go up to the microphone, and sometimes people fiddle with it and try to turn it on, turn it off, and that's an unnecessary contact. So we're working on getting some boom or shotgun microphones, I think they're called, the things that they have on the sidelines on the NFL, where they shoot it at the person that's talking so that they can just speak without having to touch a microphone. Things like that. We're gonna work on over the next to implement. So that's and what came out today was interesting, particularly the guidance on churches or houses of worship, because it provided for larger gatherings and kind of gave some state guidance on how they think it should be done. And so we would look at that very closely and make sure that at a minimum we're following those guidelines. And we're interested to hear any specific guidance from our Board of Health. So that's the general presentation. I look forward to your feedback.
Thank you very much, sir. And we also appreciate the support of the town to our board in helping us work through this pandemic. So, and I'll just offer, I had two questions. First one that obviously sprang to mind is there no way to conduct this meeting virtually or separate people in some way that, it could be virtual? I'm assuming no, or you would have proposed that, but just curious, why not?
So it's not allowed under state law. There is a provision for communities that have a representative town government that would allow them to do it in a more virtual way than our town meeting, but open town meeting, there's not currently any thing allowing us to do that. It would be great if that happened, but we know that there's been discussions of it, but I don't know how far they'll get.
Okay, that I was guessing that would be the answer. And then just my second question on the distancing, it's not really a question. It sounds like you've got a very good start on it. You're working with, all the right people. I would just offer, if people often come to town meeting with their spouse, significant other, who they can sit closer than 6 feet together. And you're probably going to find folks that want to move your chairs. And so, just thinking ahead, how do you accommodate the fact that, well, some folks, it's okay for them to sit near each other, but what you really want is to keep the people that shouldn't be sitting near each other, friends, neighbors, even though they're friends and neighbors, you want them to stay 6 feet apart, not have a social meeting on the floor. So just an observation. But otherwise, that's great. We obviously need to have town meeting, we need to pass a budget. So we can continue to operate as a town.
John, this is Bill Taylor. Is there anything about a required quorum? A lot of people aren't going to come.
We don't have a quorum requirement in Acton.
Because that was a problem when they voted in Wisconsin. The people didn't come, some did. They had markedly reduced voting areas. And so essentially, the people that did come in voted for the town, although a lot of people won't come.
Well, sounds like we're okay in that area, Dr. Bill. That just, if, less people come, that just makes your vote that much more powerful. So, any other questions or comments? Pardon me, from members of the board?
Bill?
Yes, Mr. Conaby.
Hi. Sounds like a great start. Thank you for trying to make this happen for something that needs to, which is very challenging. Couple thoughts about things. The church guidelines, one of the things they recommend is that it be outdoor activities and services are encouraged. Is there any way for a lot of the high-risk folks to be able to be outside to do part of it, to accommodate that interest?
Yeah, that's definitely an idea that we've been discussing. Logistically, we haven't figured out a way to do that, but we would certainly continue to look at it if it's something that we have to do. But I think that we do see, the thing about the gymnasium is that whatever the capacity is, we could set a number that we feel comfortable seating in there, and it may be only 200 or maybe 150. And then we could use another room as an overflow, maybe even the auditorium, and really just spread people out in there as well, so that instead of putting 350 people in the gym, you put 250 here and 200 there, and they're really separate. Outside would be the easiest way to keep people in an open space and far apart, but then there are several other challenges that are presented if we try to conduct it outside.
Obviously, there's a lot of logistics. The other comment is potentially, people are checking in. If you could do that, let's say in a covered area coming in, so you're not having people wait and congregating inside the building.
Oh,
might be an interesting thought.
We'll have to check in the front lobby. That's a good idea.
And the other thing is, at the end of town meeting, there's a mad dash to leave. So some sort of orderly plan to get everybody out without everybody quickly making the doors. No food, no drink, so you don't have trash. a spot where people could put all the recycling. A lot of materials are handed out. It'd be nice if people didn't have to collect those. Obviously, questions about face masks. You mentioned another idea about having other areas in the facility, potentially like the commons or things. Maybe you could set aside an area for those that are at higher risk that couldn't wear face masks and things, with a higher density. A lower density and more open space and more ventilation. Just a lot of different. I know there's a lower gym. That's another large space. I don't know if that would be a potential overflow space. Obviously, you're working through a lot of logistics, but space, covering, also where people are coming in and out, if you could maybe designate a bathroom for hand washing, so the doors are open, people aren't going in and out and using it as a bathroom, but they can use it for hand washing. Sanitization stations would be great. The challenges are immense. We applaud your efforts and really appreciate everything you're trying to do, and let us know how we can help.
Thank you. Those are great suggestions. And we have, what's interesting is that we have an election on June 2nd, which in some ways can serve as a dry run, or actually it'll be a real live thing. We're encouraging everybody to vote by mail. There's still time to do that. I'll take the opportunity, if you don't mind, that if you are planning to vote in this upcoming election, you can still do so by mail. If you get the application in within the next week, you should be able to have it turned around and have them send a ballot back to you, and you can vote as long as you bring your ballot in by June 2nd, or mail it in. You don't have to go to the polls that day. But yeah, we're going to be implementing some of these things at the election as well.
Okay, well, thank you. So, do you need a recorded vote of the board for endorsement, or do you just want a sense of the board to bring forward to the selectmen?
I certainly don't need a vote. I just wanted to make sure that I got an opportunity to hear some ideas and input from our Board of Health and our experts in this matter. So I appreciate that, and I appreciate your input. And yeah, we're gonna continue working on this, and we're gonna start the conversation with the Board of Selectmen tomorrow night, and see if we can set a date for a meeting.
Thank you, Mr. Cruz. I see you.
Thanks, Bill. Yeah, thanks for the good discussion here. Has there been any thoughts on pre-meeting cleaning and post-meeting cleaning of the facilities? I can think bathrooms would be an area of concern, but also physical surfaces. I know that there are some CDC guidances on cleaning.
Yes, that is a good thing to make sure that we include in our planning. That's a great suggestion. We'll have to make sure of that.
Thanks.
Other questions or comments from members of the board? Okay, then let me just ask the question in a slightly different way. Members of the board, does anyone object to the plan as please say your last name so I can get it right.
Mangiarotti.
Mangiarotti.
Yeah, you had it right before.
Does anyone have any objections to the plan as outlined?
So, Bill, we have this meeting date set. What if it's postponed? I mean, what's the impact of that? I mean, do we have to have it when it's scheduled? Like, if we didn't have it at all, what would the impact be?
We needed to adopt a budget for our operations and for the school districts that we fund through the annual appropriations at town meeting.
Okay, so if it was just focused on those two items, would we be okay?
Yes, so much of the work that we're doing is looking for ways to postpone other matters that aren't related to running the town or very straightforward things that we do every year. We're working on a list. There's 39 articles on the warrant as it was last seen, and we're looking to get that down to closer to 30, and then a majority of those would be on consent, which is usually taken up in one motion. So we're trying to get it to about 11 or 12 actions that we're asking the town meeting to take, which is a lot fewer than a normal town meeting.
Yeah, but I guess that's more than the two that we talked about that would shut down the town, which are school and municipal budgets. So I guess the devil's in the details, to answer your question, Bill, about my support or non-support of this.
Fair enough. I mean, I guess what I was mostly asking, is the process in line with, what your expectations would be. And it, I recognize what you're saying, Mike, is that ultimately it would be helpful to see a final plan, but I mean, it's going to be an evolving event, I suspect. The warrant is in development. The use of the facilities, they'll need to be able to look at what's possible. There will be some learning from the June 2nd elections, which I hopefully would be carried forward. So, I mean, I would anticipate it's going to be a process. Hopefully we'll be careful and thoughtful about the way we implement it. Yes, Mr. Economy.
I think we also need to be mindful of the state requirements. I mean, we're just starting the phased reopening. Hopefully this can be, during phase 3 or phase 4. So I guess we need to be cognizant of what the trends are. If all of a sudden the trends are getting much more dramatic of community transmission, it may need to be postponed. So I think it's an evolving situation. It's trending in the right direction right now, but as we just are starting the reopening, I think we'll have to look at that as we get closer to the actual time when the town meeting is being scheduled. So I just put that caveat. As far as much planning as we have, there's a lot of it's beyond our control.
Good point. I mean, there's always the possibility that if the situation deteriorates dramatically, that might have to have a postponement. But obviously, it sounds like the planning is proceeding in a reasonable direction. I don't have much more to add to that. Joanne, I see you've unmuted. Would you like to add something?
I did. I have a question, John. So along that thread, hypothetically, if for whatever reason towns, not just Acton, but other towns are unable to hold a town meeting this June, have you heard any guidance or any information from the Secretary of State or MMA about contingency in that hopefully unlikely event?
Yes, we've been getting a lot of great interaction with Department of Local Services and A&F, and there is a provision that would allow us to operate almost like a city can with a 1/12 budget, which would require a different level of approvals. But that's not something that we want. That would be a last resort from our perspective, because it leaves a lot of things unresolved. And being part of the regional school district, our neighbor is moving forward with their town meeting. I think it's June 22nd, and we think that the 1/12 budget would really not work out very well for us. Of course, if we have to do it, we'll do it. But I think it's in our best interest to try to get a town meeting completed before the end of the fiscal year, which is the goal of this process, and why we're going to reduce the size of what's being discussed that night to make sure it's only in one night.
Okay.
Thanks.
Thank you. Mr. Martin.
Yeah, I just wanted to say also that the way Acton's charter is structured, the new officers that are elected on June 2nd cannot be sworn in until after town meeting. And if we delay town meeting month by month with 1/12 budgets, the new officers can't take their roles. This is particularly a problem for the regional school district because there's other conventions and I think rules in the regional agreement that say that the board members from both towns have to be sworn in at about the same time. And so we would be delaying the Boxborough members from joining, and they are, the regional school committee is, what I mean by they, are interested in having their new board in place so they can plan for the fall. So there are cascading ramifications to this.
Thank you. Other questions or comments? Cheryl, do you see anyone in the public wishes to make a comment or question?
I do not.
Very good. Then, Mr. Mangiarati, did I get close?
Yes.
Closer? Thank you. And I see Ms. Berry is also on the video. Did we at least give you the confidence to move forward that I think we intended to convey?
Yeah, I really appreciate some great suggestions and some great feedback. Madam Moderator, is there anything you want to add?
No. I would just say that it is definitely our interest in keeping people safe by making sure that we get have business done and that
I think we wiped out your internet, Ms. Berry.
We'll have fewer than the usual number.
I'm afraid we only got about every other word of that, but I think I got your very first word, which was that you didn't have any additional needs from the board. Well, I apologize, Ms. Berry, but you seem to, it's, we're having communication problems. Okay, well, I think I understood that we're okay from that perspective. In that case, I think it's safe for us to move to the next agenda item. And thank you very much for including us in your process. We hopefully we can be helpful, and please let us know if there's any other future considerations or actions that you need us to be involved with.
Perfect. Thank you for your time. Have a good night, everyone.
Thank you. You too. So let's see. Next up, board discussion and approvals of governor's updates. Cheryl, this is your moment.
David, can you put up my memo that, all right. So what I tried to do here was I took a look at all the board orders since we started with this pandemic. So there's, can we just go up to the top, David? Sorry, if I could move it, I would. Oh, all right. So the first one is the board had voted to close public buildings. So I thought it was important that we make a change for that one. So the requirement from the state, we have until May 25th to implement the safety standards that we talked about previously, which we've already been working on. Like I said earlier, we'll have to amend that. If you want to go down, I was thinking maybe it might be best, I don't know, Bill, might be best to just vote as a whole, or, just basically a vote to make changes based on the governor's new order. I don't know how you guys feel about that. So the second one that we have is the construction site. So the governor has made changes to construction sites effective today. And, basically in a summary, it's, safety protocols. They may need to have an independent third-party inspector. Where we go, there's a zero tolerance sick policy. They've got to have to certify to their supervisor that they're not having COVID related issues. Hand sync, so it's very, very similar to, but with a little update. So that's the construction one. And if we could go down. So the next one would be the Board of Health voted to close hairdressers and barbers, massage services, body art, and body work. So effective May 25th, the governor has allowed hair salons only to be permitted to be open. So we would need a vote to allow hair salons to be open. And again, this is safety protocols, 6 feet separation. David, can you go down a little bit so I can say they have to have their chairs 6 feet apart. They have to have access to hand washing. It's requiring them to change their capes every time. They're required to wear gloves. They're looking for improved ventilation, physical partitions between workstations, no sharing of any common touch tools, disinfection between, of all common touched items, and basically reminders of, clients' hygiene and safety protocols. And again, all these include the wearing of masks. So can we go down a little bit more, David? So the last one I have, and I promised you I'd talk about this one. So there is a specific safety and reopening standards for parks, open space, and outdoor educational programs, which is also effective on May 25th. So this language talks to a public park, porta potties, and athletic fields. So we have to have a conversation about the athletic fields because, as I mentioned in my update, there's some conflicting information out there. So again, we voted to close Narra Park. So this is saying that the park should be open for open space walking, hiking, biking, running, and other activities. Again, social distancing, 6 feet away, posted signage. Hikers should move aside and leave room for others to pass. You should wash your hands or use hand sanitizer. Then we go down to athletic fields. So it said athletic fields and athletic courts can be utilized only for non-contact sports with no shared equipment such as tennis and pickleball. So again, this requires a lot of safety protocols. But I also, as I mentioned earlier, I did see guidance that says that tennis can only be played with family members. So we'll have to talk about that one a bit. And then public restrooms, there's some safety protocols for those as well. Basically similar to kind of the stuff that we've already talked about, but we need to adhere to CDC guidelines pertaining to cleaning and disinfection. We should have the facilities cleaned at least once daily by staff, and deep cleaning twice a week. And then we don't have any composting toilets. Should replace with temporary. So hand washing, sanitizer. So we'd have a little work to do to open up the field here, but it's something I think that's achievable. And I think, can you go down? So the other board, I just threw in this memo as well, the other Board of Health votes that I didn't see any guidance for today new guidance today from the state. So I just I actually went through all of our minutes and tried to pull out any board vote that we've done in the last couple months. So these are the other votes that there's no guidance for at this point. So, but they may warrant a conversation, so I threw it in the memo.
Okay, well, thank you, Cheryl. You've certainly given us a lot to think about. Just having read through a little bit of it on the little time we had before the meeting, here'd be my suggestion, which I'd obviously would like fellow board members to comment on. We have a meeting scheduled for this Wednesday, so that would give us an opportunity to take actions, specific actions that would be needed before the 25th. I'm thinking that for tonight, we could either do it by vote or just by poll, but affirm that all previous Board of Health orders should be interpreted consistent with, the most recent state orders, governor's orders. Because I note that many of them are read, like for instance, the one on hair salons say that the ban is in effect until the state of emergency is lifted. You could make an argument, to me anyway, it would make sense that the governor saying, well, it's okay for hair salons to be open, would be the same as lifting the state of emergency. Now,
I don't think so, Bill.
Well,
because it says that the state of emergency still exists in his order today.
Understood, but I mean, as just saying what we intended was that it was, to be in harmonious with the governor's order. That's why it says will continue until, state of emergency is lifted. And like I said, that's my interpretation. But we can certainly be much more explicit, but I'm not sure we can go through each one of these and get it right tonight. So, I think we could certainly affirm that we wish to be harmonized with the state, but maybe we need another day or two to get the specific language if we want to be purposeful about each of the previous orders, like the ones with the hair salon. And to Mr. Conaby's point, we can explicitly say, the prohibition on hair salons is now removed, consistent with the governor's order of May 18, such and such. So that would be my proposal. Mark, comments? I see you're on mute.
Yeah, it's problematic when these things come up, and I'm expecting we're going to see a lot more guidance and follow and more restrictions being lifted and changes to the order. Maybe a simple, we've got 3 orders: public buildings, construction, and I call it allowed business activities. Because it's not just essential ones, there's some ones that are now being added. So maybe it would make sense to just take action to the extent we amend the recent Board of Health orders related to the COVID-19 to update and incorporate the new requirements and restrictions of the most recent Commonwealth of Massachusetts order, which are inconsistent, superseded, or additionally required by that order. So they're kind of basically incorporating all of their changes into ours. So if it's superseded, such as allowing salons to open, that would be allowed. I would suggest we just do it for the construction, the businesses, and the public ones, and deal with the parks, because that's not a required one. And the governmental operations is a separate matter, because that's within the town control. So what's being superseded for the businesses and other activities would be part of the amendment. Hopefully that wasn't too confusing.
I think I stayed with most of it. I'll put it in layman's terms. You're suggesting we do a sweeping, motion that would effectively say, parts that are superseded by the governor's order of today would be superseded. And
well, there's more to it, because there are also new requirements and restrictions. It's not just being superseded. So when you have the public buildings, there are new requirements to it. There are, requirements you self-certify. You have to have cleaning plans. There's a whole bunch. It's opened with restrictions. So that's the difficult part. So not only does it change what was previously ordered, but it allows certain things with restrictions, with new restrictions would have to be incorporated in that order. So I'm saying it's going to be changing and evolving. Having one set of standards, which is the state requirements, might be a lot easier for everybody else in the community for both enforcement and for understanding.
So one thing I did, Bill, was I put the language of the guidance document in the memo that you have in front of you. So I took it word for word. So if that's helpful to you.
It is, and it's also some of our orders. I mean, reading through them, some of our orders are advisory in nature. So I'm, not sure that they're as urgent that we take action on because it wouldn't put the town's order in conflict with the state's order necessarily. But, well, Mark, since you were sort of taking the lead in parsing out how we might approach this, what do you think of the idea of deferring action on the things that can wait until the 25th and to a meeting on Wednesday when we might be able to craft some more, I'll say, targeted language to address the issues?
I think that sounds fine to the degree we can. I'm just not sure we can defer the first three items, which are the construction activities, because it was allowed as of today. The hair salons, which are going to be which are going to be prior to the next meeting, and the public buildings and libraries and things, which are also going to be prior to that. So
No, Mark, there's a meeting Wednesday, 2 days.
You mean 2 days from now?
2 days from now.
That would work for everything but the construction activities.
And the construction one, I think it's actually our order, I'd have to look at it again, but memory is it was actually instruction to the town departments to follow the governor's order, something very similar to that.
Some other requirements. I guess for that one in particular, because there's a whole series of certifications and requirements, and they are a bit different, probably it would be good to just be clear on that one, that we would amend that one to incorporate the new requirements and restrictions of today's order, which are inconsistent or supersede or additionally required by the governor's order.
Okay. So keeping that in mind, let me ask other members of the board, how do you feel about that approach of, we want to, I'll say, harmonize with the state and clean things up. We have a meeting in 2 days. We could try to make that meeting very quick in the sense that, we could effectively run through the list and vote the changes, but it might be more orderly than trying to do it on the fly tonight. I'll start at the top. Dr. Taylor.
I'm just wondering if we can approve the items that go into effect before the 25th. That would be other businesses, construction sites.
Well, Wednesday would be the 20th, so we'd be well ahead of the 25th.
All right. Okay.
Okay. Mr. Cruz.
Yeah, I tend to agree we can probably wait till Wednesday for most of these. Regarding construction, while driving by construction sites, I don't think they're really heeding our orders anyway. So, from a practical standpoint, I don't know that it makes a difference, but, I could go either way on that.
Okay. Ms. Becerra.
I think it makes sense. That way we can be a little more thoughtful and, like you said, not do it on the fly tonight.
Okay, but you might consider Mr. Conaby's suggestion that we amend the construction order. Joanne, that was a question. Okay.
Sorry, I pressed the wrong button. I thought I disappeared. Yes, I agree with Mark. Sorry.
Okay, perfect. So, given that, it sounds like, Mark, would you be willing to state a motion to the effect on the construction order?
Yeah, I can do that. I think I kind of emailed a suggestion to Cheryl, so she has that. But basically, you'd move to amend the Board of Health construction order related to COVID-19 to update and incorporate the new requirements and restrictions of the most recent Commonwealth order of today, which are inconsistent, supersede, or additionally required by that order.
Okay, very good. Is there a second?
Yeah, I'll second that.
Thank you, Dr. Bill. We have a motion made and seconded, and I'll ask members of the board, is there further discussion? Seeing none. Cheryl, does anyone from the members of the public wish to comment?
No, I don't have any hands raised.
Very good. Thank you. In that case, let's vote. I'll go from the top down. Dr. Taylor.
I'll vote aye.
Mr. Cruz.
I'll abstain.
Very good. Ms. Becerra.
Aye.
Mr. Conaby.
Aye.
I will also vote aye. So we have 4 aye and 1 abstention. Motion passes. Well, thank you very much. I do apologize because it does mean we'll have to have another meeting this Wednesday. I was hoping that this was going to be an either or situation where we could have either Monday or Wednesday. It looks like we're going to need to do both. I will, to my fellow members, I will promise to try to keep the meeting on Wednesday as short as possible. We can pass over the update portion from the director and just move directly to voting the amended orders to account for the current state guidance, which was made at the last possible minute. And we can try to make it a very quick business meeting. But I apologize for the necessity. It also, I can sense Cheryl is thinking, great, this means I have to go and get all of these cleaned up before Wednesday. So I apologize to you also, Cheryl. And Dr. Taylor, I see you've unmuted. Do you have a comment you wish to add?
No, I'm sorry. I'll mute.
No worries. It's with when we're not physically present, it's, I can't read the body language, so I have to go by microphone mutes, which Dr. Jacoby, you just unmuted.
Oh, no, I'm fine. Thank you.
Okay. And Mr. Cruz.
Bill, I really like the updates from Heather, but maybe we should give her a day off on Wednesday.
That was my suggestion. So okay. Excellent.
You just said health director, which is Cheryl. So.
Oh, you're correct. Yes, I did say that. I was using the royal, the inclusive we, or the inclusive health department. Sorry, it's getting late. All right. Well, in that case, I think we're ready to move to the next item on the agenda, which is related, has to do with use of athletic fields, non-contact athletic sports. Cheryl, do you mind introducing this topic?
Yeah, so this is a discussion we had at the last meeting. This was specifically, we talked last meeting about allowing tennis, but, as I mentioned a couple times tonight, we have conflicting data on the state website, one speaking to the tennis only being allowed for same family members, and the other one being that it can be allowed without, because it's a no contact sport with less than 10 people. So,
well, it gets even more complicated. If you read down the guidance that I saw from the state website, it talks about indoor sports facilities. And it mentioned that they were not allowed until phase 2. And it gave examples of things like batting cages. So they were saying even things where there's safe distance or no contact, it still implied that any indoor sports activities are restricted until phase 2. And
yeah, and I mean, we had a conference call today with the DPH, and I posed this question because I'm seeing conflicting things. So I was told that we have another conference call tomorrow at 3. So I don't know how I'm going to have time tomorrow to get everything cleaned up for you, but I'll give it my best shot. But I'm told that we should have an answer hopefully tomorrow by the DPH on this. So that would probably be better discussed on Wednesday if you wanted to add that as well.
Well, I was just specifically thinking about indoor tennis courts. So my reading of this would imply that indoor tennis would not be permitted until phase 3. And thank you, Mr. Martin, for pulling that up so I can see it. So I just say, yes, the situation is murky at best. It seemed to imply that outdoor tennis might be acceptable after the 25th. So more clarity coming, but that might be something that then we could have more affirmative information on again for Wednesday. Mr. Conaby, I see you are unmute.
Well, I hit it by accident, but it is pretty clear that they state that only certain business activities are allowed to open, and it's not one of the listed ones. And when you look at what is allowed, it talks in phase 1, athletic fields and courts as limited contact, but it says no permits for group gatherings, no pickup games, no organized things, and it says only players from the same household. And of course, the limitation of less than 10 individuals still applies. So, and that is under the outdoor activities. When you look at what's allowed for the businesses and the guidelines, it has outdoor recreation is phase 2, indoor phase 3. So it's a challenge. And unfortunately, what they're talking about for athletic fields and courts is under the parks, which are the municipal. We really need to know whether or not, they can provide all the sanitization, cleaning, and oversight to allow safe operation of the facilities before they're reopened for the town. And then for the businesses, they have all their new restrictions, which just came out. And that's a whole other issue to deal with.
So my suggestion to my fellow board members for this particular item is that we defer also until Wednesday, when we might, capital M, have some further definition from the state. Because the guidance appears to be conflicting, but it does not appear that in any of the readings that I've seen that it's immediately available to open. Comments from other members of the board?
It's certainly not clear. Waiting a couple of days would certainly be consistent with what we talked about the last meeting.
Okay. Very good. Any comments from members of the public, Cheryl?
No, I do not see any hand raised.
All right, very good. Well, it sounds like we're going to have a busy few days, but I think that does mean we can go to the next agenda item, which is drive-thrus. And I happen to remember that because I'll take the blame for putting this on the agenda. The CDC, as part of the national opening strategy, recently came out with their own set of guidance. We have lots of people offering their guidance. One of their suggestions was that promote the use of drive-thrus. They were suggesting it for pretty much any reasonable business activity that could be conducted by drive-thru. Their logic is that it sort of by the process provides social distancing. It puts a physical barrier between the staff at the business and the customer or client. And, it allows people, there isn't a public mingling area where members of the public to mingle. Acton has a prohibition on certain types of drive-thrus, and I know there's a long history on this that Mr. Martin may be able to brief us on. So I asked that we bring this for discussion so that the board could provide an opinion to the selectmen on whether it's reasonable to consider revising or relaxing or another way modifying the current prohibition on drive-throughs. So, Mr. Martin, if you wouldn't mind just taking a moment and give us a little bit of the background and what the challenges might be to implement this and what your recommendation would be.
Sure. So in the past, these have been considered a little bit separately between pharmacies and restaurants, and it also depends on the area of town because there have been proposals to amend certain zoning districts. In general, there's been more support for drive-through pharmacies. The real sticking point the last time this was discussed was that the CVS pharmacy on Mass Ave when it was built, the CVS made a point of not meeting the town halfway with that building. The town wanted walkable access to the building, and CVS refused and put the only entrance at the back of the building. And so the town meeting was not inclined to give them the drive-through which they wanted. However, since then, I would say that there is some support for pharmacy drive-throughs. I think, we haven't voted on it, but I think there are certainly members of the board that are amenable in our brief discussion about this. I don't know exactly how the vote would come out. And even before this pandemic, there was sympathies for, a parent with a sick child having to drag the child into the pharmacy to pick up the medication for the child. So there's certainly there's definitely some support there, and I think both in the town and the select board. As far as restaurants go, I see less support in the town, and again mixed in the select board. Although again we haven't voted, so I can't say for sure. In the past, there have been objections to drive-through not being in the character of the town, and also that they, having idling cars certainly contributes to global warming, things like that. I would say, from my own observation in the current crisis, there's if you're talking about takeout from one of our restaurants in town, or whether those restaurants have drive-through, I think the contact difference would be minimal, and in fact, you could even say that it would be greater in a drive-through, since the attendant has to hand you your takeout order, whereas most of the restaurants I've taken out from, they have a separate table set up with the orders prepared, and you come in and pick up yours, and you're actually not, you're farther away from any person in the restaurant. So those are the two things. I'm happy to answer questions as far as I know from the background of these issues.
Okay, well, thank you very much. I appreciate that. So as I mentioned, I asked that this be on the agenda for board discussion because it is a CDC recommendation, and it is one that I'll just say most towns it's not an issue. They can, but Acton is unique in that we do have a limitation on drive-throughs. So, members of the board, how do you feel about it? Rather than pick on someone, does anyone wish to speak to this, or should I go down the Joanne?
Yeah. So I think having drive-in pharmacies is probably a good idea to consider for all the reasons that you mentioned, both for parents with sick kids, they don't need to drag them in. And then also, for folks who are disabled or elderly, it's, they don't have to get out of the car and go into the store. So I would be in support of considering this change in town policy.
Okay. Thank you, Joanne. Well, I'm going to ask Dr. Taylor, what do you think?
Yeah, I would agree with that. The pandemic's not going to last forever. I don't know how much it costs to put in a drive-through window.
I don't either.
But it may not make it good business sense.
Right. Obviously, it would be permitted, not required.
Correct. Exactly. So yeah, I think it makes sense with the pharmacies.
Okay. Well, I'd like everyone's opinion. So, Dr. Jacoby.
Yeah, I think is probably the same as everybody else, that in a pharmacy, it probably is a good idea, but as far as the whole town and other options, I don't think it's really a Board of Health issue. I think it's more of a selectmen's issue.
I agree. It's absolutely, there's a lot of it that is not health related. The idea, you know, and this is just from the CDC guidance on restaurants, because they actually did call out restaurants specifically. It was to prevent members of the public from getting close to each other when they go to pick up their food. And also to, a lot of the drive-thrus, and I guess it depends on how it's constructed, and maybe that's something the selectmen could add, is, you know, they're in some ways like a bank drive-through where you don't touch the attendant or clerk, or there's no opportunity to touch them. You know, the bag of food is placed on a extendable platform or shelf, and you know, you take it off the shelf and go on your way. So, you know, that was the idea, is that it prevented, and then, you know, there was a physical barrier between you and the clerk. So, you know, if one of the two of you was infectious, you didn't have an opportunity to communicate that infection between the people in the car and the people in the restaurant. Whereas, you know, counter service, I guess there was always that possibility. So, Mr. Cruz, do you have an opinion?
I do. Is there anybody asking for this bill, or any businesses? Or is this just hey, we want to align with the CDC guidance?
So I'll just answer strictly from my perspective. I noticed it in the CDC guidance, and I thought we should discuss it. But maybe Mr. Martin, and I see he's primed and ready.
Yeah, but before Mr. Martin offers his opinion, I just see this like health-related issue turning into a non-health-related issue for a large portion of the town residents, and rather than I would just table this unless someone's asking for a drive-through in a pharmacy.
Okay, Mr. Martin?
So I think that the CVS on Mass Ave has always been interested in doing this, and I think they would be eager, and I believe the building was designed to be able to accommodate this, and we just didn't let them. The town meeting didn't vote to allow them. And at that meeting, and it's things since, there are townspeople, like I was mentioning earlier, people have said, you know, when they have a sick kid, or people with disabled relatives, having to take them into the pharmacy was an ordeal. And so there are town residents who would also like to see drive-through pharmacies. I agree with people on the board here who've said that, you know, maybe the drive-through restaurants is a little bit less of a health issue, but I think that, you know, the pharmacies are certainly someplace where you guys could weigh in.
Okay, thank you. And I would just offer one of my concerns about pharmacies is people have needs for medication, you know, even when they're COVID positive. I know the correct procedure is to have someone pick up that medicine and deliver it to them. But, you know, I think that that's not always followed. And, you know, for business reasons, a lot of the pharmacies always put the prescription pickup counter in the very back of the store, you know, guaranteeing that you have to walk past the greeting cards and the batteries on your way. And unfortunately, that gives an opportunity for someone who's COVID positive and needs to be there to pick up a prescription to interact with members of the public. So that was sort of my thought, besides the sick child, which is also another very good reason. Dr. Singh, do you have an opinion?
I agree with the suggestion, and especially for pharmacies, we should have drive-through.
Thank you. And Mr. Conaby?
I generally agree as well. Support the guidelines. One quick question, looking at the proposed bylaw, it says that the window should be integrated or attached to the building. And I'm just wondering, where one of the pharmacies has set up things outside temporarily to have basically non-contact delivery. I would suggest that we want to encourage the non-contact and not really get into the business operations. We really should just be focusing on the health aspects of this and supporting different means and supporting the guidelines of safe delivery of the medications, especially, and other products in the community.
Okay, thank you. Mr. Martin?
So I just wanted to say that for us in Acton, this would be implemented by a zoning change, which is why all the detail here regarding the building. And also, just as a note, whether it could make this year's town meeting is certainly not certain. We would have to agree to do it. The other boards, like the planning board, would probably have to agree to do it, and it would have to. We'd have to decide to put it on a shortened town meeting warrant this year if we think it's important enough to make the cut, and 2/3 of town meeting would need to vote for it. So we still have many steps to go before we get there.
Completely understand, and it's maybe a bridge too far, but I figured this was the situation that would demand it, so it was incumbent on us to at least bring it up. So, Mr. Martin, do you feel you have enough to carry forward to your fellow selectmen? Would you like us to just draft a few sentences and vote on it, or?
Sure. Either way, I think I have it. Let me just say what I heard is that there's general support from the board here tonight, especially on the pharmacy side. If anybody wants to correct me that I heard it wrong, you can say so, or feel free to write a letter to the select board. Either way.
Okay. Well, thank you. Do you have a meeting tomorrow night?
Yes, we do, and I think this is on the agenda, if I'm not mistaken.
Oh, great. Okay. I think if you carry forward the message, that would be fine. I just wondered if you needed something.
No, as long as I understood it correctly, and then I'm happy to carry it forward.
Okay. Well, I'll ask the reverse question. Does any member feel that Mr. Martin has the incorrect assumption? Okay, I think we're okay.
Thank you.
Well, thank you. Good luck. Obviously, if the select board wishes one of us to make a presentation or answer questions, we could be available to do that. Next on the agenda is the minutes. Is that correct? It is. So I'll admit, this is a set I have not read. Has anyone parsed the minutes and feel comfortable that we can move them forward? Everyone assumes that you do such a great job. Hello, Joanne.
I've read them not with the fine-tooth comb that you typically do, but I've been mostly for content, and it seemed to reflect the meeting as I recall.
Very good. Any other brave member wish to take credit for the minutes? What I'm really suggesting is, can we motion these minutes into history, or do we want to postpone until a future meeting?
I'm happy to move that we approve the minutes.
Very good. Is there a second?
Yeah, I'll second it.
Very good. Motion is made and seconded. Thank you, Dr. Taylor, for seconding. Sorry, just for recording. Well, we'll take a vote. All those in favor, Dr. Taylor?
Aye.
Ms. Becerra?
Aye.
Okay. Mr. Cruz?
Aye.
Very good. I think we have Mr. Conaby.
Aye.
And I will also vote aye. So meeting minutes are approved unanimously based on Joanne's recommendation. Thank you, Joanne. I very much appreciate your jumping in and helping us out. Okay, so I believe that that brings us to the conclusion of tonight's agenda. Is that correct? Cheryl's nodding yes. So at this time, I'll just ask: is there any questions, comments, final concerns from members of the board? And just a reminder, we did sort of agree we'd go ahead and have a meeting this Wednesday, but we would give the health department and the nursing service a break from doing operational updates. Mr. Cruz.
Yeah, Bill, I think we have one hand up from the public.
Oh, yes, thank you. I was going to ask for that once members of the board had a chance to comment. But if there's no other questions or comments from members of the board, do we have a question or comment from the public?
We do. Call in user number 1. Go ahead, Tara.
Hi there, it's Tara from West Acton, and I was very surprised to hear you vote on to support a zoning change without taking public comments. I'm also concerned that the presentation didn't talk to that this seemed to come up because the McDonald's wanted to go back into business with drive-up service. I actually, and then CVS jumped in on it, but I actually was for this because of the many reasons that you stated during the meeting. But I personally took the memo that was provided and I forwarded it to my West Acton Village Merchants Association list, and I couldn't believe how many comments came back. The Acton Pharmacy is dead set against this. He says that it'll cost him $100,000 and however many months, he said it'll put him out of business. If CVS gets a drive-through down at Kelly's Corner, he'd have to lose 2 spaces, I think it was, whatever it was, he's not set up to do it. Then local restaurants started chiming in, talking about being put out of business and saying that large companies can put drive-thrus in and that this is designed to and advocated for by large company industry advocates or whatever. And that we should really, I think, take a step back and at least survey our small businesses. They've got enough trouble staying in business as it is. I think this would be a death knell to the ones that were commenting to me anyways. And it saddens me, and I'm almost done, it saddens me that a board would take a one-sided view, or that one person came and proposed it, or a couple people came and proposed it, and you didn't get public comments before you voted to endorse the thing. So I hope that you reconsider the vote to support and ask some of the local healthcare professionals whether they like this idea. And relative to making grand assumptions about, Acton Pharmacy delivers, by the way, so anybody that has to go out for a prescription with a disabled kid in the car or whatever, they don't even have to go out. They can drop it right at the site. So I hope that I'm very concerned about process, and I would like you to take a survey before we start down the path of town hall pushing something, advocating, selling, and getting a couple of boards and committees to stand up and advocate, and then it turns into a big fight. And it seems like there's a much easier way to come to consensus on some of these issues than to, do like the hard sell, if you know what I mean. Thank you.
Okay, well, thank you for your comments, Taryn. I mean, you make good points, and I would just offer part of the reason I'll take the blame for, like I say, bringing this up was the guidance just recently came out from the CDC, and I realize if we want to get it on this year's meeting warrant, which is a very much a maybe, as Mr. Martin has stated, that time is of the essence, and selectmen meet tomorrow night, and so we needed to at least give them a sense of which way the Board of Health was leaning tonight. So, unfortunately, the virus is pushing us to a timeline not of our choosing. But thank you, though, for your comments. And I'm sure the selectmen will consider that as they have their deliberations. Okay, again, I think we have made it to the end of tonight's agenda. It's been a busy meeting, and we've got a lot in front of us. Again, thank you, everyone, for hanging in there. And I see that the Zoom just ended, so hopefully I can still contact members and ask, does anyone wish to make a motion to adjourn?
I just stopped projecting, Bill. The Zoom's still going.
Oh, good. Okay, because all I see, all of the video profiles disappeared.
Well, the good news, Bill, is yours appeared finally.
Oh gosh. So I had a joke all prepared, and I know this is a serious meeting. And we'll try to. So I'll try to keep it serious. But when I saw that the salons are opening as of May 25th, they apparently there was subsequent guidance that said it was based on the amount of hair you had, and that those that had the most hair could get to go first. So I called for my appointment, and I'm due to get a haircut in September. So just thought I would point that out. Okay, that's tonight's levity. And Dr. Taylor, I believe you are adjourning. Were you motioning to adjourn?
Yes, I was.
Very good. Is there a second?
So moved, so seconded.
Very good. Thank you, Mr. Cruz. All those members in favor of adjourning tonight's meeting, please say aye.
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 That's 3. Mr. Conaby?
Aye.
Very good. That's 4 or 5. We are adjourned. Thank you all very much. Apologize for the Wednesday meeting, but I'll see you all virtually Wednesday night. Good night.